Hello again. I'm Dr. Robin Saltz from Miami, Florida, and we are going to talk about headaches. Actually, I'm going to talk and you're going to listen. Headaches come in 4 different varieties or flavors, if you will. The first one is vascular headache, which has to do with blood flow to the head. The second one is a cluster headache. Those are the worst kinds of headaches because those are very sharp and stabbing-like and usually are more frequent in men than women for some reason. Then there's the very popular tension headache, which who doesn't get a tension headache once in a while? And that's also known as a muscle contraction headache. And that can really bother you and interfere with just the way your life can go on, as well as migraine headaches. Migraines are what we're going to talk about a little bit more because migraines can be completely disabling to certain people, and the causes of the headaches can be anything from certain allergies to foods. The most common are wine and cheese, and that's kind of a bummer if you're going to a wine or cheese party, or both. I would say it's the preservatives maybe in the cheese and the sulfites in the wine that sometimes can trigger migraines in certain people. Then of course there are things like stress. Stress can cause headaches as well, of course. Who doesn't have stress with job and family, and even hormonal stress? Women with their periods just know at certain times of the month when the estrogen and progesterone are doing certain things in the body, going up, going down. That can sometimes trigger migraine headaches. And if they know that, sometimes they can do something before it gets to the point where it's a throbbing pain in their head, that's for sure. High blood pressure. A lot of people say, oh my goodness, you know, if I have a headache, my blood pressure is too high. The blood pressure has to be extremely high to get a headache, and by that time, that's a dangerous level for the blood pressure to be. A lot of times you can have pressure that is over what is comfortably borderline, and you can feel fine, and that's why they call high blood pressure the silent killer, which can trigger things like strokes and heart attacks and aneurysms. The classical or typical migraine is one that's on one side of the head. I mean, you could get a migraine that's generalized over your whole head, but usually it's on one side or the other. It typically starts with what we call visual scotomata, which is flashes of light almost obliterating part of your vision, which can be very disconcerting to a lot of people. They may think something's wrong with their contact lens or that something's wrong with their brain function, that type of thing. But once you're used to that headache, it's not as alarming anymore. Not that you ever want to get used to a migraine. The headache usually is accompanied by light sensitivity, so people prefer to lie down in a dark room. Any kind of noise can trigger the migraine. Sometimes the lights or the noise from an ambulance passing in the middle of the night, or a police car if you're out driving, that type of thing. And of course migraines can cause the very uncomfortable nausea and vomiting. Now migraine, usually the migraine prodrome, which is what happens before the migraine headache happens, is the best time to take treatment so that you can prevent the headache, which can last anywhere from minutes to hours. And some of my patients actually says they last for days. So you definitely want to catch the migraine in the earliest stage that you can recognize it. And people that have had migraines say, I know my vision is getting like a bad television with the lines across it, that now's the time to take a strong cup of coffee, because caffeine will cause the blood vessels in the head and the eye to shrink and close down and vasoconstrict, which will help the migraine, which is made worse by the vasodilation or the enlargement against the skull, which is very hard and does not give, as you can imagine. The second treatment would be something like maybe a certain type of over-the-counter remedy, like a Tylenol or an Advil, which almost always has caffeine in it. And then the last, the prescription medications, would be something that would maybe prevent the migraine, something like a beta blocker, which causes the decreased heart rate so that you don't get the throbbing of the blood flow to the head. And then, of course, once the headache pain starts, you need to take something prescription that will just totally help and block the headache pain. And those medications come in oral forms as well as sublingual under the tongue, and self-injectables if you're brave enough to do that, and even intranasal administration. So those are 4 ways to get headache relief pronto. Of course, the best thing is to avoid them in the first place. So if you know that there are certain scenarios that trigger these migraines, whether it's a certain time of month or a certain food group, then of course it's best to avoid these things. I'm Robin Saltz, talking to you from Miami, Florida. Have a great day.